So I'm Sue Gallagher. I was a primary teacher and I used to train teaching assistants. And my husband was in the mountain rescue. He was an electrician. He was in the mountain rescue in Cumbria and he knew the English lakes like the back of his hand, and he took that part of what he did very seriously. But he had a great sense of fun. He was a great raconteur and brilliant company. So Bob had Parkinson's, which he didn't tell me about for 2 years, and vascular dementia. And he spent his last 3 years in long-term care. And we had tried to navigate the health and care system, especially when it came to seeking respite for both of us. It was all very disjointed and it always seemed to land back on me as to whether we got to the right place with the right information. So we were really casualties of a range of systems which mostly didn't work for us. The weekends were the time when everything would implode. I couldn't manage Bob, or the care home where we found a place would say they couldn't meet his needs, as they put it, and I came to dread that phrase. And there never seemed to be any support apart from calling an ambulance, and that wasn't what either of us needed. So after he died, I looked back at what had happened and decided it must be better than this. And could I stay involved with health and care services in different ways? So with the privilege and the opportunity I had of working with professionals, I've learnt lots more now about the patient experience and the patient journey, those pathways. I can be part of making this better, but I have to work at it. I have to earn the trust and the respect of those people I'm working with. I have to make it clear that I'm not just there to moan on or keep repeating my story or find fault. And I try to understand the challenges of their role and the obstacles that get in their way. So I believe patients are partners in their own care, and there should be greater encouragement for them to ask questions and discuss options and make informed choices. And we should also engage with and learn from, I think, those patients who say that their experience was good, so therefore what's the point of joining patient groups? But we need them to say what was good, what worked. Overriding all of this is that conversation with the patient, and that's the bit that needs time. But it is crucial for better care because you get to know the whole patient in their context. Because as patients, we're not just a collection of parts. We are somebody, usually with a family or friends or a carer, with someone who could be worried about something that we haven't shared with you yet, but that's making us appear disengaged. And we could be somebody who can't quite process everything speedily and may need a bit of a chat before we can get to the point. We're someone who needs to be cared about, not just cared for. In the care home where Bob spent his last years, they had a policy of families could go in any time, which was really great. So I fetched up one Sunday morning and Bob was in his room with a carer called Paul, and they were doing a crossword when I went in. And as I went through the door, Paul looked up and he said, "Well, I'm glad you're here because Bob said you'd know what 14 across is." So that said to me a huge number of things. It said that he knew me as well as Bob. He knew what we liked to do, that we shared these crosswords. It was what we did. But it also said that he had permission to sit with Bob and do a crossword, and that was part of Bob's care and therapy. And I've sort of kept that example because I think that's a great example. So, if I'm honest, I dread hearing we don't have time for conversations. We have to make time in order to save time later on. And staff may need permission culturally to make this happen. And some organisations have a life story book which accompanies a patient, and a quick scan through there could tell you so much. It could give you the beginnings of better communication with the patient. So, is the journey smoother today? Well, I believe that there are signs in North Cumbria, through its approach to integrated care, that there is progress in wrapping around the patient in all their parts, physically and mentally, and getting them to the right care with the right team. My question to you in terms of conversations would be, would you make time for a conversation with a sick child and the family because you knew you could learn so much? Every patient, no matter how young or old, needs that opportunity. Thank you.